The empty space left by a missing tooth initiates a silent, cascading mechanical failure. This foundational bone requires constant stimulation from a tooth root to stay healthy. Without it, the jawbone starts dissolving away. Surrounding teeth then lose their structural support. They tilt and slide into the vacant gap, throwing the entire bite out of alignment. This internal collapse eventually changes the exterior of the face. As the jawbone recedes, the lower cheeks and jawline lose their scaffolding, leading to a sunken appearance and visible aging. Tooth loss is an accelerating physical breakdown that compromises the integrity of the entire lower face. Addressing this level of decay or bone loss typically requires a full mouth reconstruction, a process the dental industry has standardized into a months-long timeline. The traditional model relies on fragmented logistics. Dr. Joseph T. Mormino addressed these delays by physically uniting the clinical treatment rooms with the manufacturing laboratory. This setup removes the external bottlenecks that define the rest of the industry. There are no transit times and no third-party scheduling delays to navigate. The layout creates an immediate feedback loop. Laboratory technicians work directly with the dentist and the patient to design and mill customized, lifelike restorations in real time. Controlling the entire manufacturing ecosystem is the baseline requirement for achieving both high-end precision and a rapid turnaround. Dr. Mormino utilizes this integrated system to execute a specific restoration protocol called Smiles Tomorrow. The process begins with a titanium implant, a small post that serves as a permanent replacement for a tooth root. Placing these immediately stops the bone loss we saw earlier by providing the jaw with the stimulation it needs. These newly placed posts act as a permanent, unmoving anchor for a full set of replacement teeth or dentures. While the patient remains under the doctor's care, the on-site laboratory is already fabricating the bespoke restorations that will attach to those anchors. This chart shows the result of that efficiency. A process that once took months is compressed into about 24 hours, restoring the full function and aesthetics of the smile in a single visit. Smiles Tomorrow re-engineers the restorative process, replacing a long-term logistical crisis with a 24-hour medical resolution. Beyond the mechanical speed, the treatment changes how a patient experiences the recovery process internally. Dr. Mormino renovated a residential home into his dental office to avoid the cold, intimidating feel of a clinical practice. The environment includes amenities like gourmet coffee and warm neck pillows to lower the patient's stress levels. This judgment-free environment, combined with the lack of a long waiting period, helps remove the shame often felt by those who have avoided dental care for years. By eliminating the friction of long waits and the anxiety of a typical office, the treatment addresses the patient's peace of mind alongside their oral health. For the patient, the final result is the ability to reclaim a healthy, confident life without the physical burden of decay. This integrated model has been verified by decades of patient outcomes, where rapid treatment led to life-changing results and long-term oral stability. Advanced dentistry has reached a point where rebuilding a failing smile no longer requires a patient to put their life on hold for half a year. By integrating a manufacturing lab with clinical care, the path to a healthy smile doesn't require a long wait. It starts tomorrow.